All right, everyone. Hello, and welcome back to another Agilify automation webinar. Today, we've got a couple of really good guests where we're going to be discussing a lot of things that you can learn from the healthcare industry and their evolution with intelligent automation. First and foremost, let me introduce you to a couple of folks that are going to be on here having this conversation with me. We've got Kim Kass, who's the Agilify Director of Business Development. And we've also got Anna Twomey, who is the Senior Solutions Advisor for Blue Prism in the healthcare industry. Anna, do you want to take a chance to give a little bit more of a background about yourself?
Thanks, Dave. I'm Anna Twomey. I am the Solutions Advisor for Blue Prism for both public and private sector here at Blue Prism. I have a little over 25 years in healthcare and have been working with a lot of different companies, including working with CDC and NIH for several years. I was Bioterrorism Administration Manager for the city of Houston during the 9/11 crisis, and had a lot to do with where we are today with the COVID crisis as well. It seemed like deja vu at times. But over time, I've worked with a lot of different clients and decided to make Blue Prism a home when I found RPA because I was so excited about the products that they have to offer. So I'm here to talk about automation and some of the things that we've been doing.
Thanks, Anna. And Kim, can you take a minute to introduce yourself and give a little more background?
Sure, absolutely. I'm Kim Kass. I have been with Agilify for over 4 years. Been in the healthcare industry for over 20, and really just very passionate about automation in the healthcare space. I kind of came into automation backwards, if you will. I started in healthcare, have always been really passionate about efficiencies and giving clinicians time back to do what they love. And then automation came to me afterwards. So it was a really neat opportunity to merge the two. I'm very excited to be here today.
Awesome. Thanks. Thank you both for being here. I think we've got a really good topic for the audience here. And no matter what industry, I think you're going to learn quite a bit about this journey that automation has had on the healthcare industry. So, I mentioned sort of the topic, and yes, we are going to focus on healthcare, but I think what you're going to see is just the way that automation has evolved and where it can be applied. And we're going to go through some use cases here today between us. And historically, where we started with healthcare and automation in general, if you think about it across many industries, have been really keen in on mostly back office functions for a few years before we started really getting some headway into other possibilities of work. And we're going to cover a few of those things for you guys today. Where I'd really like to start, though, is just kind of looking at some of the history that we were just talking about. And I'm going to turn it over to Kim here to highlight, a couple of solutions that, since COVID has really hit, we had some opportunities, and it really, kind of hit hard with healthcare, obviously. And Kim, can you dive into a couple of areas where automation has really been seen as a real solution for the healthcare industry? And then Kim, once you've kind of highlighted those, I'd love to get Anna's perspective on those as well and see what she's seeing from a Blue Prism perspective.
For sure. So as you mentioned, really in the beginning for me, what I noticed was automation was really impactful in back office first. And so when COVID hit, the very first client that reached out was in the purchasing space. We had done work there before. They knew the value of automation. And so they immediately came and said, we're experiencing this huge influx of work in an area that we hadn't seen it before, specifically PO line cancellation. There were medical suppliers. There was such an increased volume of back orders and canceled items on purchase orders, and the team could not keep up. They weren't staffed to do so. And so they reached out to the Agilify team and said, can you help? You've done so much good in the past. And it was really neat to watch. We built an automation in 8 days to help this team. I mean, there was over 200,000 lines worked with this automation. There's no way that a small team could have done that on their own manually. Over 7,000 hours saved. And so it was a really neat opportunity for us to jump in and build on the success that we had already seen, but now in this COVID world where data and accuracy and speed to delivery is so important.
That's rather impressive if you think about, the time that you put that solution in. Was there any, for us, we'll put some links and things to some of these use cases as we go through these so that you guys can read more about them. The back office, as you mentioned, Kim, is really where we started in healthcare to begin with, right? And we've built a lot of momentum. Can you talk about some other areas that this is kind of leading you to now? Do you have anything else that you would like to share historically there?
Yeah, so I've wanted for such a long time to really get into the front office space, and it was a harder journey really for the team. But when COVID hit and we had examples of really where we had just done some great work, and we were able to enter the pharmacy space. And it's just been really exciting to see. One particular that I would call out is around automated dispensing cabinet reconciliation. And really, the gist of it is the pharmacists were having to go in to make sure that the medication that they were giving to the patients was in the appropriate amount of time, which was a very short amount of time that they could get it, verify that the patient should have the medication, get it to the patient. It was a huge associate dissatisfaction because there was a disconnect between the pharmacists and the nursing staff in terms of how quickly they could get the information and deliver the information and then give the medication to the patients. And so this was a huge opportunity for us. And it also hits a couple of other areas that are not necessarily COVID related. So although it was a COVID automation, it is a huge satisfier in the HCAPS space. And also it really talks to diversion. So most hospital systems experience some issues with nursing where they are not appropriately or perhaps taking medications for personal use or other things like that. And this automation really is able to identify if any of that is happening. So although it was completely about COVID and speed to data, just like the purchasing one, there were some other benefits as well. And then just opened up the pharmacy space in general for us.
One of the things that you highlighted there too is pretty fascinating when you think about the evolution of automation and where people were looking for the benefit in automation. And you highlighted a couple of things that have really evolved from the experience side. And we've seen more and more customers start to focus in on those things too, as well as not just looking at dollars saved and hours saved. It really comes down to some experiences as well as compared to whether it's your own employees and customers are just as important to organizations. So, Anna, I'd love to turn this over to you. Kim has shared a couple of really good use cases and experiences within the healthcare industry and how that really evolved from back office into a clinical side of things. And it's really starting to highlight some of the opportunities and raise awareness there. And I'd love to be able to hear your perspective on where you guys have been and where you've seen successes and maybe where it's going.
Thanks, Dave. And yes, those were very exciting opportunities to hear about. I'd like to learn more about those as we move forward. And that surge period that we went through right there, whenever, it was becoming much more known in the media. I started noticing it around February and March because of my background with FEMA and with crisis management. But I didn't officially get a call until around March 15th. And then CDC called and said, if you're still in public sector, we could use your assistance. I said, I'm not, but I'm with a company that has digital workforce that we could put, bots and seats that'll, replace the boots that you have to have on the streets. And it turned out that way, that it actually, one of the first places that they said that they needed help was that surge area of needing to get PPE out to the proper places, get the ventilators out. And we talked to this one federal department. This is where we made our first application for the COVID crisis. Was one of the federal agencies was trying to distribute personnel, people, places, things, and get it all stood up in areas that the crisis had hit the hardest, and they were needing they were actually just using different spreadsheets, and they'd have a screen over or a screen over here, and then trying to collate it and get things together. So put together the ability to not only integrate with inventory systems to order the supplies that they needed very quickly, but a command center dashboard that allowed them to see where their supplies were going, where the personnel needed backfilled, how quickly the cases were spreading. And that was just in the very beginning initiative. So using digital workers to kind of pull all that search together, and then that later evolved into part of the Warp Speed project, and they put several digital workers together as a part of that initial crisis. But those were some of the, and those weren't exactly healthcare related, but everything about this crisis has been healthcare related in one way or another, because, in highlighting another use case that we were working with, right after we had completed, or not actually completed, we were in the throes of working on the supply chain management for the federal agencies. That's whenever the entire country went into kind of a shutdown, and a lot of businesses were losing revenue. The CARES Act dollars came out, but just the ability to capture information that the small businesses needed to apply for the loans to keep their employees employed and working was a tedious process. So they came to Blue Prism, and we put together a very quick application for the digital workers to work with the banks. We worked with Citizens Bank and a couple of other banks, major banks in the area, to automate the process of putting all of that business information into the SBA's loan department. We actually were so successful, they came back and said, can you slow these bots down just a little bit? They're processing too fast and they're shutting down our website. Within 72 hours, we did somewhere around 144,000 loans and had more than $1 billion that we were able to get into the hands of those businesses that needed it most. So, it wasn't just a healthcare crisis. It was a healthcare crisis, but it affected so many different lives in so many different ways. And we were very thankful that we had the technology there to assist in those particular areas the most.
And those are really good examples of, just kind of being prepared for, or looking at things the way the work gets done a little bit differently, because before the pandemic, those were not necessarily areas that we would have looked at and been like, that's a great opportunity for automation, right? Like, I look at Kim's example of the purchasing. It's like we had such a huge spike in changes in the way the transactions are typically done, or cancellations, and that took a lot of time and effort. Before, it was such a small part of their day to do that, and it was like, yeah, let's not worry about that. But then something like this happens and it changes it. And to your point, Anna, around the small business loans example that you just provided, it's like, yeah, I'm sure they were used to going through and looking at small business loans, but at that velocity and that spike in applications and things like that, it really needed the help of outside of a human workforce to be able to handle that sort of capacity. So really good examples there. And it looked like you might jump in and say something there. Go ahead.
What I was going to say is you look at the aspect of whenever something like that magnitude happens, it affects so many different areas. And the thing that they need the most is information, data-rich country, but how we manage that data has not always been efficient. And that's one thing that digital workers brings is the speed with which they can facilitate that, and overcome those barriers in a particular time of surge, and whenever that is most needed, I think has been the most impactful.
So really good examples of where we've been with COVID when it really started hitting. And I'd like to stay with you. Can you talk about where you guys are looking at and implementing some solutions that are currently being developed?
there's a couple of good examples, and these sort of evolved out of the two that I was talking about earlier, because one of the first things that I talked with the CDC about was our ability to capture information for epidemiologists and infection control. So talking about the pharmacy stuff and the ability to do that was fantastic in on this, because we also started talking to a lot of state and local governments about their epidemiologists and how they were gathering the information that they needed to do crisis management. Even from the perspective of out there taking surveys of the vaccines, there were epidemiologists that were actually at the different sites where vaccinations started to happen with the current personnel or the emergency personnel that were first vaccinated, and taking surveys to say, have you been exposed and who have you been exposed to? But they were doing it all manually. So we started working with them about ways to automate that process, to get that data and information into a cohesive manner that could be used by the other epidemiologists that were doing infectious disease studies. And that evolved into them saying, well, if you're taking this survey information out here at the drive-through clinics for, at that time, it was just first responders, we have, an influx in need for supply chain management to work with the COVID vaccines that are going to be rolling out to the public. So that's one of the things that we're currently working on, is working with both box pharmacies and the big pharma companies, as well as just the hospitals and clinics that are giving the COVID shots now. More to, I think we're in phase 2. We're not quite to phase 2. We're still in 1B, starting to vaccinate some of the elderly personnel, or elderly patients first. So that's one area that we got into. A lot of our hospitals are using it to report back to the states and local governments. Of course, this is in some instances the first time the pharmacies have ever had to report given vaccines, because when they were giving out influenza vaccines, that wasn't a requirement or a necessity to report back to the state or to the federal government. And so that was an added task that there was no human available to do. And it is, a very manual task. They didn't have ability to do bulk upload from the EMR to get that information. So we first started working with, or I'm not supposed to say the names. You'll have to cut that part, right? With a box pharmacy, to start getting that information reported to the state and local governments and to the federal agencies as to who is being vaccinated and why. That also led to a secondary use case, and I'll try to keep these shorter, but the crisis claims management, we call it, is a lot of Medicaid claims and Medicare claims that started coming in that resulted from maybe people losing their job and having to go on Medicare or Medicaid and still receive treatment. But they were not properly enrolled in the system, nor were the providers that they were using properly enrolled in the system. And so it resulted in a lot of claims coming back to the states, and the states having large stacks of claims. They were like, they're stacked to the ceiling here. And these were paper claims at that point. They were just HCFA forms and, hand filled out in many cases. So we created a way to scan those information in for the digital workers to pick up on it using OCR, and extrapolate all the information to create an e-claim that goes into MMIS system, into CMS at the states and the federal levels. So we've worked on that with several different states. I think it's probably very similar to the states that you guys have also been working with on some of the reporting.
Yeah, and that's sort of a really good transition right there, and into some of the experiences that Kim and her team have been working on, some exciting stuff that they've got going on. Kim, I'm not going to steal any thunder from you. I'm just going to let you jump right into it and talk about specific use cases there.
No, that sounds great. And Jim, I don't know if you could put up the slide that we created, but I think that this particular use case is one of the most exciting and really has been the most impactful for our team. And we were brought in right at the beginning with one of our healthcare clients who had a need, it was a large healthcare client, and they had a need to report within 24 hours every vaccine given to associates. So with patient EMRs, there are interfaces built into most of the state registries, but that's not true for the associate EMR. And it was a huge problem. And we were brought in, and we were able to build automations really to one out of the associate EMR, and then different automations into each state registry in our book of business, if you will. As you can imagine, every state registry has something different that they need reported on. And there are little differences in some cases, but significant enough that you literally are building different automations for each state registry. And then there are some state registries who won't allow the automation to go directly into the registry. And in that case, we were able to build a file, if you will, that is HL7 formatted or compatible. And so that was able to go into the state registries that wouldn't let the bot go in just on its own. And so at this point, we have reported on the vaccines for over 140,000 vaccines registered. And I think the latest numbers, if I am remembering correctly, are I think 9,202 hours saved, something like that. And it grows every day. So those are probably not accurate even from right this moment. And it's really just been a huge associate satisfaction also, in addition to just the compliance and regulatory issues, because if the automation was unable to do the work, then you're really talking about, I think that when we last looked at it, we were talking about over 35 FTEs where they would have had to just manually enter in the associate EMR and then again into the state registry 9 to 5, Monday through Friday, 5 weeks. So it's been really, really exciting and humbling to be a part of that.
The other thing to consider there too is you mentioned it, this 9 to 5 sort of work effort that it would, from a manual standpoint. Digital workers don't take lunch. They don't, restroom breaks, smoke breaks, whatever they want, right? Like
yeah.
they don't get those opportunities to do those things. And humans, they need that. They need their time. And again, this goes back to the experience. Could you imagine asking 35 people to work 40 straight hours to get that stuff done, right? Like,
well,
insane.
Yeah. And not only that, but they have day jobs, right? So we would be asking them to do that full time. And that means that these are occupational health nurses. So that means for those 5 weeks, they're not taking care of associates who need their help, and they're not doing, they're not delivering the work that they should be doing on a regular basis. That all stops just so that they can manually enter.
Yeah, that's not the career they thought they were getting into. If they
no.
Right? So great, and to Kim's point, hopefully you got a chance to see the graphics and things like that are supporting that, and links to read up on more information on those as you guys are going through this webinar with us. We're gonna move on though, and we're gonna start talking about what's next. I know this has opened up a lot of different doors for Kim and her team in healthcare. As we outlined a little bit earlier, we were talking about how this was mostly a back office sort of focus automation was, and now with over the last few years, Kim's team has made a lot of headway on the clinical side, and COVID really amplified that. For her and her team on some opportunities, and it's really opened the eyes there. And I'd love for Kim to jump in and talk about some really good examples of where this is leading to and where they're headed next. So Kim, go ahead and take that away.
Sure. I think seeing the success specifically of the vaccine registry automations really has opened the door for us in some other spaces. So staying with the focus of COVID, the next one that we're getting started on is around these mass COVID vaccination clinics, and then going from vaccinating to billing and reporting out on the clinics, and then making sure that the claims go in both into Cerner and to other systems. So we're getting started there for sure. The pharmacy program in general has just exploded. As I mentioned, that was one of our first, and I think we're on our 5th or 6th automation that we are either delivering or in the process of looking into there. So really rev cycle, pharmacy, and then just building out the clinical practice in general in the nursing space, because they've seen what we can do in times of crisis. And I've mentioned this so many times on this particular conversation, but it is the speed to data that I think you can talk about until you're blue in the face, but COVID's given us the opportunity to show that we really mean what we say, in terms of how quickly we can provide the clinicians in particular with the information that they need.
Awesome. And I know, Anna, you've got some really good thoughts behind where this is really kind of taking, the Blue Prism experience on this too is really opening some other doors for you guys. I'd love to hear your perspective on where this is headed for you.
Following what's gone on with the COVID crisis, and knowing that, all of this new, what we call the net new now, virtual world of everything, right? There was the new now, and now then there's the net fallout as to what people will want to experience now whenever they do go back to attending a virtual appointment with the doctor or attending actually going in to a facility. Things have, because we've all been, changed the way that we do business in life and the way we move around. Most of our stuff has become virtualized. So we took that approach and we looked at it from a perspective of not only telemedicine, but what the clinics are doing right now and how we can assist our patients with better having access to care in a time that they no longer really want to go in for visits in healthcare anymore, because they're like, we're exposed. It's still out there. It's still a big black monster that we don't know where it resides at this point. So facilitating a lot of that, we've put a lot of time in that as a company to start looking at virtual patient engagement. Okay, how do we engage with our patients from where they are at night when they're scrolling through their tablet or through their, and they're like, I've got a toothache, I need some help, I can't let this go on, or I've got an earache. How do I go ahead and contact my doctor? Can I make it a telemedical visit? All of that is about automation. As soon as they click on that, on that website, then the digital worker can pick up and do chatbot with them. And so we're looking at adding a lot of those different into making the patient experience just as enjoyable and rewarding as it would be if they were seeing that doctor, but yet from where they sit now, and changing home health as a result of that as well. So it takes a look at all the automations from beginning to end, even supply chain management, rev cycle. What if tomorrow, those 600 data entry people that normally are entering claims for over here. I mean, they're like right around my corner over here, and they've got 600 people sitting there entering revenue cycle claims. What if tomorrow again they were sent back home and everything wasn't ready for virtual world? The digital workers are going to have to pick up at least the night shift, even if they broke it up and had them come in during the day. So more and more the are becoming almost a mandatory type thing for everything. So as a company, we just kind of broke down the entire life cycle of a patient from birth to death and said, how do we approach this, and what areas can we have digital workers take over tasks that are not human specific? And that's the direction that we've been taking as a company moving forward into the next few months.
And, we've spent a lot of time already on between us three having many conversations in the healthcare realm, and I know most of this webinar is dedicated to talking about healthcare experiences, and they've kind of been the sort of out on the front line of tackling this with automation and trying to figure out how they can become better at their operations and document management and things like that. But one of the things that we really wanted to talk on in this webinar too, and Anna, you brought it up in earlier conversations, is where do we see other industries learning from healthcare? Where have you kind of seen this opening the eyes for other industries and how to actually effectively use intelligent automation to their benefit?
Well, speaking personally from my history in public health preparedness and watching what happened with the revolution of all industries, moving forward from 9/11 to where we are today, we went through a lot of preparedness exercises, huge surges and changes in the energy industry, huge changes in automotive industry, and how they were preparing their staff for pandemics such as this and things like that. Healthcare, we tried to make, or we did make a lot of progress in that 20-year span, but I don't think we were still quite as prepared as we are now, you know, having come through this crisis and found out where we're lacking in certain areas. That's impacting everything from banking, with our banking industry and the ability to do they watched us process all those small business loans. They were like, hey, you know, why have we not already started processing all these other loans with that same urgency? And so now that's that way. Us working with claims process management in the federal realm and doing Medicare and Medicaid Advantage type stuff. So that's affecting a totally different area of healthcare. Working in the energy industry, working with insurance providers that normally you pick up your tablet or your cell phone and you're like, okay, I need to get some auto insurance. You click on your auto insurance, within seconds, you got your insurance. Well, healthcare wasn't there. And during this time of crisis, our ability to get there, choose our healthcare plan, go ahead and make our monthly payment or make it a part of our daily life, you know, every month, this is what it is. That's not there yet. So I think that in each one of those industries, they have felt the impact of what the disease happened, you know, how it happened, and their preparedness levels are going up extensively.
Yeah, and you know, that's something that really jumped out as we were going through that experience too, with a lot of our healthcare and life science customers, as well as again, this goes back to, you know, not paying attention to some of the things that may not look like great opportunities, but then, you know, at some point when you want to get ready for the future in your digital transformation journey, those are the things that you're really going to have to take a look at and be like, you know what, that if something like this ever happens again, that is something that we can just take off the plate and make sure that it's done to both of your guys' points around, you know, you're going to get high accuracy and quality and speed around some of these things. Why not allow the digital workforce to do those things and allow, you know, your nurses, the people who are administering vaccines and all of those folks actually do what they signed up to do with their careers, right? And feel like they have more value there. Now, we've talked about some of the other industries there, and I thank you for those highlighting some of those other ones, but there's another, we call these horizontal verticals, right? So all your industries and, you know, whether it's manufacturing, automotive or whatever, but we've also got this thing, you know, from a horizontal perspective that goes across all those industries where we look at it from a function standpoint. And Kim, I know you have another story around, you know, IT's involvement in some of the journey there of trying to get them up to speed on what automation can do. Can you jump into your use case here?
Sure, and it's really the use case that I've already talked about. I mean, it goes back to the COVID vaccine automations, but really what happened was IT came to us because the associate EMR version, you know, many down the road would have an interface built to the state registry, but it was a year and a half out, most likely. So they came to us and said, you know, we don't have a choice but to report out within 24 hours. And you know, we looked at plan A and it's not going to work because, like I mentioned, we won't have this interface built until X date. And so, you know, is this something you can do? Because otherwise the plan C really is pulling everybody and everyone stops their day job and starts to manually enter. So it was this really unique opportunity to really solidify where we fit in. And where we can be a tool in IT's toolbox. We are part of the solution. And for them to see us that way and really understand where we can work collaboratively together, it was a huge growing opportunity, I think, for both organizations.
Yeah, and when I was talking back office, you know, typically where we've always seen a lot of success has been finance, HR, supply chain, and those, and IT has always kind of been the ones to come along and feel like they can get a solution in place quickly. But, you know, when they get hamstrung like that, it was great to see them reach out and trust us to be able to do those things. It was awesome.
Yeah, I think it was really nice to finally be understood about where we can fit in together. So COVID really gave us that. interestingly enough.
Awesome. So that's really the extent of what we were going to chat here today about on this webinar. It was really, you know, we brought to you guys a few healthcare use cases, but more importantly, we were really wanted to highlight and showcase where this thing is really starting to expand outside of, you know, historically being a back office, seen as a back office solution, and where it can be seen more on for healthcare in general as a clinical aid, but you know, other industries are starting to see that as well and implement automation into experience, you know, into opportunities to impact experiences and audit and compliance and avoiding regulatory fines, those sorts of things. And those all add up. So that automation is not just going to be looked at as an hour saved or dollar saved, or I'm trying to replace human capital and things like that. This is way bigger than that. And healthcare was really seen in the spotlight over the last year and is really making headway with what they want to do with their automation program. So I appreciate your time, Anna and Kim, and bringing all of those use cases to the table. Hopefully this opens up some eyes for others who are watching this. And if you've got any questions, you can always reach out to Anna. We'll put some links to everybody's profile on this webinar to Anna and Kim. And please ask more questions if you've got any. We're here to help, and love to be able to answer those questions for you.